Thank you, Elena.
Thank you. Okay, welcome everyone. Good afternoon and welcome to our community COVID-19 roundtable. My name is Karina Sanchez and I'm the COVID-19 response supervisor at North Lawndale Employment Network. We thank you for taking the time to join us as this work is very important for us. Now let me give a special thanks to the support from NLEN, UIC School of Public Health, the marketing department at North Lawndale Employment Network, to Elena Gormley and Michael Bradley, the Chicago Good Work Partnership, and GoodKids MadCity. Now, please let me introduce you to my co-supervisor, Louis Williams, and our community, our COVID-19 community response workers, Mary Tidwell, Dorisela Vargas, Sarah Hawkins, Pamela Guerin, Trachelle Williams, Courtney Holmes, Ayana Lloyd, Lakendra Robinson, Rosa Alvarado, Bradley Hawkins, Efrain Champion, Aldrina Jacobs, and Maya Barber, who is our moderator and organizer. Thank you, Maya. The floor is yours.
Thank you, everyone, for joining us this afternoon. A quick background of NLEN. We are an organization who has been around for the past 22 years and thriving. Our mission is to improve the earnings potential of the North Lawndale community through innovative employment initiatives that will lead to economic advancement and improve the quality of people's lives. So a few of our programs are the U-Turn Permitted program, Pathways to Prosperity, our Ready program, our List Financial Opportunity Center, and our Sweet Beginnings LLC, which also we have our Sweet Beginnings Be Love products, and we have the Be Love Cafe. And one of my favorite drinks from the cafe would probably be the green tea matcha. It's like better than Starbucks, and I know that's a pretty high, ranking, but it's one of my favorites. So we're going to get started with our first round, and we're going to be introducing GoodKids MadCity. I have had the pleasure to be a part of that organization, and it's truly a phenomenal youth-led organization. One of the founders is actually Dayamanti Wallace, who we have the pleasure of speaking with today. So Dayamanti, I'll give you the floor.
Hi, Maya, thank you for that introduction. I love NLEN. I mean, however much time I've spent working with you all and being able to be in space, which is really has been incredible and has added so much value to my life and my work. So thank you, and I'm happy to come and talk and answer some questions. So like Maya said, my name is Dayamanti Wallace. I am the co-founder of GoodKids MadCity. We just had our 4-year anniversary on March 14th, and now we are doing mutual aid work. We're doing restorative justice work in CPS, really working with youth and students to figure out how we can really inform and educate our peers as well as the next generation, really making sure that the work that we do that's rooted in radical practices, radical love, and abolition really inform how we move forward through the next generation. So yeah, that is a quick spill about GoodKids MadCity. I'm happy to answer more questions about the organization later, but I want to make sure we have time.
Yeah. Thank you, Dayamanti. So if you have your questions, you know who you are. We're going to get started and make sure everyone is ready to do so. So of course we have our little, oh wait. Okay, first question.
Hello, good evening, everyone. My name is Trachelle. My question is, what has been the most challenging and rewarding about your school experience during COVID-19?
Yeah, so for me, I'm a junior in college currently, but also working with, have been working with high schoolers, and my little brother's in high school. So I think I can speak to both experiences. The part that I will say has been rewarding is the opportunity to really spend time with my family and still be able to have that support through college, which I think is I guess supposed to be a time that you're independent. But just being able to go back home and have that support during these last few years has been really rewarding, and being able to be at home. I think speaking to high schoolers' experience, watching my brother really have to, I was able to sit and help him go through this high school experience, which I wouldn't have been able to if I wasn't at home, and really like share knowledge, being able to love on him and give him hugs during those really hard times. So I think that that support has been really rewarding. And I start with rewarding because I think that that is the only thing I can point out as far as what's been challenging. I think that we're missing key quality time with our peers. And I think a lot of high schoolers missed out on that quality time of really relationship building and making friends outside of their respective activities, and really being able to have those opportunities to meet new people. And I think that those connections with adults were also missed out on as well. From a lot of the high schoolers that we work with, they don't know their teachers, right? Like they don't even know what their bottom half of their body looks like until they were able to get back into school, which is something I think that we strayed away from, and not really understanding what a physical connection, just being able to see someone on a day-to-day basis, even if you aren't talking to them, seeing them in the hallway is something that was really missed during COVID. But also that face-to-face learning experience, right? Like a teacher being able to come and like put their hand on a student's back and be like, you got this, right? I think that that experience is something that a lot of high schoolers missed out on, which is something that I in my work feels very crucial, is making that connection, that kind of like hand holding, that like, how can I help you, sitting down, come to my classroom after, right? Like with Zoom, you just log on and you log off. So I think that there's a true like disconnect that happened, especially when you get into those high school years. You're making a huge transition. So I think especially for freshmen and sophomores, they still feel stuck in middle school. It doesn't feel like they're the age that they are. I'll talk about my brother a lot, but he's 17, right? But still what does that mean for him, right? Like there's a lot of conversations that can be had, but that real life experience of like hanging out on your own, being able to go to the movies with your friends after school, like that kind of independence and real, like that just feels like something that was really difficult and challenging. And I mean, we can talk about the schoolwork and things like that, but I think that there is a true person-to-person link that is missing, and all of those events that happen throughout those times. And I mean, people are talking about not going to prom because they just don't care, right? They don't care about high school. They didn't care about, because they didn't meet anybody that was just like so interesting or so wonderful. So I think that that's something that stood out definitely in our work.
Okay, thank you so much.
Of course. Next person.
Hi.
Hi, my name is Sadie. So what was the most challenging for me, being a college student myself, was going to school remotely, because the work kind of doubles on you, and trying to get used to doing things remotely and not seeing people in person. And now that we are in person going to school, that option, the rewarding option for me is to be in a classroom with my peers, and them having the opportunity to choose if they wanted to wear their mask or not, and not be judged by it.
Thank you for sharing. We're actually going to have like a sharing towards the end so that everyone will be able to add their pieces into the equation towards the end. But we have the next person who will be able to ask the question. You know who you are.
Hi, my name is Sarah, and my question would be, do you feel as though the pandemic has affected your mental health, and how?
Yeah, so it definitely has. That's just the first like blanket answer. But I think that the pandemic was paired with a lot of real world things that were already happening that I think we were provided distractions previously to feel like, oh, you know, something's making me sad. Let me go out. Let me, you know, put a Band-Aid over this and worry about it later. But I think the pandemic was really a pause, and everybody was able to sit and say like, oh, I need to deal with this, or I need to process this. And I feel like sitting all that time at home and not really knowing when you could go outside, when it was safe, you know, and outside, I feel like going on a walk, or let me run to the store really quickly. I don't really need anything, but I just need to do something. Going out with your friends, that was all, those were all experiences that aided people's mental health. Like, you know, somebody is sad or dealing with depression, and we're always like, oh, open a window, go outside, you know, like get some fresh air. But that wasn't necessarily the answer anymore. So what did it turn into? So I think a lot of things that GoodKids MadCity was dealing with, and that I was dealing with specifically, is how do we find comfort, and how are we content within ourselves, and not needing those extra kind of those extra things coming from outside. How do we start to, like, I don't know, help yourself, or how do those things start by being inside, you know, buy a plant, you know, do something that kind of made our own space easier to be in. So I feel like for me, it definitely it affected my mental health. In the beginning, I was like, oh my God, I don't know what to do. Like, I am feeling this way all the time. There's a weight on my shoulders. Like, I do not know what to do. But I will say that for me, the work that we do with GoodKids MadCity is always very rewarding for me. And it always makes me feel good to be able to help people. So we started a mutual aid program after a few weeks or months into the pandemic, where we were giving out $50 to 20 people every Friday. And that was something that I could really look forward to doing, of being like, okay, this is helping, being able to help other people. And it was all just me sitting at home, writing down numbers and taking people's names and then sending out money. So I think that there was truly a shift at some point, and I don't want to say it was halfway through or 75%. I don't know when it happened, but making that decision to channel my energy elsewhere, and really put my energy into the work that I was doing, into feeling like, okay, this is what makes me feel good, and being able to identify those things really helped. And also there was a lot of free therapy resources that we were gathering for people, and making sure that they had folks to talk to, and offering ourselves up as a resource. So I definitely feel like it affected my mental health in one way that was really negative. And then it moved to something more positive, which I think a lot of folks were granted an opportunity to feel everything and kind of mull through it. And by that time we thought maybe it'd be over, but then, you know, we were still in lockdown. So it was like there needed to be a turning point or a shift. So I definitely feel like there's I don't know, there's almost a twofold answer to that question. And, you know, talking to high schoolers, talking to a lot of younger folks, they didn't even understand what was happening as far as mental health wise. They don't have the language or the resources to have that knowledge, which I think now we're noticing a shift in schools a lot more. Is they're starting to talk about mental health. They're starting to talk about, how do you manage your feelings? How do you manage your emotions? How do you work through them? Which is some things we've been noticing in the classroom, which is really good. So I think that there was some positives, some negatives, and we're still working through it.
Thank you. Of course. Okay, we have our last question for you.
Good afternoon. My name is Courtney, and my question that I have would be, how have you adapted to life during this pandemic? You know, changes you've made to your, you know, everyday life. Like, how have you adapted to it?
Yeah, me personally, I don't know if I adapted to it in the healthiest way. I think provided me so much more time to fill with so many other things. So started doing more work. Oh, of course I can do this because it's on Zoom. And I think that there was a lot of space, like 24 hours got a little bit longer since we were at home all the time, or since we were in this pandemic and we could be anywhere in the world virtually. And then, you know, that kind of like opened up a new door, which I don't know if it was necessarily good or bad, but I think that one big thing as far as GoodKids MadCity specifically goes, we really leaned into what restorative justice meant and what mutual aid meant and what the word community meant and how we can uplift the people that are around us. Summer of 2020, I believe, we started doing Boxville, and every Thursday, I think it was, we would give out boxes of food for free. It didn't matter. People just drove up and we had somebody go put it in their car and then they drove away and that was it. Never knowing someone's name or hardly what they look like, but being able to have that kind of sense of community. And then we started doing more where anybody could come and give away free stuff. We had a plant truck come, folks were able to get plants for free. Femme identifying folks were able to get like makeup and a professionalism kit for job interviews, and it was all free. You just come up and grab it and that was it. So that was something for us, really leaning into what community meant, because we didn't have to, it didn't need to be some big event. We didn't need to plan it. It could be like we stood somewhere and had a table of free stuff and folks are willing to drive up and come and get it. So I think that has been a wonderful adaptation of just thinking like, what does it mean to really, like, metaphorically, because we're not 6 feet, right? But holding hands with people in the community and making sure that they feel safe and taken care of. And that was really about leaning into mutual aid as well. We saw a lot of folks become housing insecure during the pandemic. We saw a lot of folks food deserts. Of course, folks are living in food deserts, so they don't really have access to just being able to go to their local grocery store, right? They have to drive super far, but then they have to think about how are the cases in that specific neighborhood? Should I be going there, right? We saw a lot of these things come up, which were already there, but they were kind of being masked and lulled over by the fact that there wasn't a pandemic. But I think it really heightened and highlighted a lot of the issues that we were dealing with. So we were able to take donations, get folks food, get folks money, and noticing that those things are a lot more tangible than a meeting in City Hall being like, come talk to your mayor, right? Like we noticed that they needed something a little bit more. And that was kind of our go-to. That became our bread and butter almost. How do we lean into community and get them tangible resources for the things that they need now? Because we noticed folks are still dying no matter what we did for the long haul. If we were planning an event and it was happening 2 weeks later, how do we help those people in those 14 days who might need immediate assistance? So that was something, and we've truly, our organization adapted and grasped to that very well. It's something that we still do, even though the world is kind of opening back up now.
Thank you for your answers. I think that was amazing. We'll have a chance to circle back towards the end, but now I would like to give Karina an opportunity to do our next introduction, and I'll stop sharing because I know they have a presentation as well.
Thank you, Maya. Now I would like to introduce you to Dr. Linda Forst. She wears many hats in the healthcare field. She's the course director at UIC School of Public Health. She is also a director for the World Health Organization Collaborating Center at the UIC. Please welcome Dr. Linda Forst.
Hi, everybody. Really nice to see you all. I did not prepare a slideshow. I know that that's not typical of people from a university, but I work both in the School of Public Health. I'm a professor there in environmental and occupational health sciences. And I'm also a physician and see patients at UI Health in the clinic. And we were involved because we're the only public health school in the state of Illinois. We were very involved in assisting the state health department and the City Health Department and Cook County Department of Public Health, and really a lot of organizations around the state in standing up their efforts related to COVID. So I volunteered on a hotline in the beginning of COVID that IDPH set up, where people could just call in and ask questions about protecting themselves, where to go for care before there was testing available, and so on. I was able to do that work. I consulted a lot to industry, so I'm trained in occupational health specifically. And as you all know, either from your own experience or from reading the news or whatever, that there were certain segments of the workforce that really got hard hit with COVID. And a lot of those folks were people that had to, I mean, obviously people that had to leave home for work. So people that worked in transit, in manufacturing, in the beginning in restaurants and grocery stores, places that did had outward facing public service kinds of work. And so I had the privilege really of being able to consult to some of those employers and to workers and worker groups around how to protect themselves during the pandemic, and then also maybe also to do some research related to that. And so a lot of the questions that I've gotten over time, it's sort of migrated, I guess, as people in Chicago and around the country and the world really have gotten more and more sophisticated and knowledgeable and really in sync with what's going on. I think we've had this kind of collaborative journey of figuring out this pandemic, how to prevent illness, about vaccines, how to help our neighbors, and so on. A lot of that was discussed already. I think it's been this kind of collective journey in learning about this. And so I didn't want to come here and lecture at you about aspects of the pandemic or protecting yourself or the vaccine. I will do one shameless promotion, which is if you are interested in university, come to either our bachelor's or our master's program in public health. We're doing a lot of great things. We can arm you with information and a skill set that can help you go out and do your work better if you're doing outreach in communities and so on. So feel free to email me directly, lforst@uic.edu about that, or really anything. But I really wanted to open this up to questions and answers.
Okay, well, we can get started with the next round. 1 second, I will pull up my screen again. So we'll go ahead with the second round. And the first person.
Hi. Hello, Dr. Forst.
Hello.
My name is Mary Tidwell, and my question is, what factors were taken into account when the city decided to start lifting the mask mandates?
Great, that's a great question, very important question, and a very nuanced question in a way. Mainly, it had to do with the reduction in cases, the number of cases in the city, and the number of deaths, also the rate of cases and deaths. So you probably all know that Omicron, there have been waves of illness, hospitalization, and death during the last 2 years. And we're just coming off of a wave, actually, of the Omicron variant. And when the numbers fell, the number of cases, hospitalizations, and deaths fell in the last month or so, that's when the city decided to lift the mask mandates. Also, there's some harmonization with other cities and states, and also using guidance from CDC and looking at data from other countries. I think all of those things played into the decision.
Thank you.
Next person, please.
Hi, my name is Pam Guerin. Have there been studies that test long-term effects of the vaccines on our health?
Yeah, so you're talking about the mRNA, the vaccine technology, I think. Yes, the mRNA vaccine technology, this is not the first time it's been used for vaccinations. It was used for Zika, which was several years ago, and a couple of other viruses. And the technology's been studied for probably 2 decades now. So it's been tested in laboratory animals. And the other really important thing is that as soon as it was being rolled out for use during the COVID pandemic, the country and many countries around the world have started collecting data. So there's lots and lots of data about health effects of the vaccine, of the virus, and of the impact of the vaccine on the virus and on human health. So what are those studies? There are people enrolled in trials that are being followed. So the people that were first vaccinated, that there were drug trials initially, right? Pfizer and BioNTech and all them, Johnson & Johnson did drug trials, and they have continued to follow the people that they vaccinated from the beginning. So those were kind of some of the main trials in the US and around the world. Also, people have self-enrolled in trials. So when people were first getting vaccinated, they agreed to report symptoms and so on, and to be followed over time. And so here we are. The first vaccines were in December 2020, I think. I mean, the testing was started before that, but the vaccines for the public were rolled out, I believe, started in December of 2020. And so there are a lot of data that are available to us to look at that. Just to say that most of the side effects occur right at the time of vaccine. So we all read in the news, and we got the vaccine, so we know about the most severe side effects. When I got the first vaccine, I was fine. When I got the second one, it walloped me, and I was laying on the couch for about 20 hours. And then I perked up and felt fine. And then for the third dose, I was fatigued for like two days. And I'm relatively old relative to you guys in this room. So younger people who have more robust immune systems often felt the acute effects of the vaccine earlier and more severely because you guys had a bigger response. In terms of long-term, there's way less than 1% long-term effects. There were clotting disorders associated with the Johnson & Johnson. Nothing else has really held as being any kind of a long-term effect of the vaccine per se. The other thing to note about it is that the mRNA, the actual stuff that gets injected, it does its job within minutes to an hour. It gets transported to the cells, causes you to develop, that spike protein antibody within, it takes 2 days for it to completely elaborate, but the message is transmitted within minutes to hours. And then the mRNA that gets injected gets broken down by the body, so it doesn't persist. So I think we don't have to worry about that part of the scenario. And then instead of anticipating your more detailed questions, you could just go ahead and ask them.
Okay, we have one last question in this part of the roundtable. The person who...
Hi, my name is Dorisela Vargas. My question is, are there or will there be long-term growth effects of the vaccine on unborn children and young children?
Yeah, that's of course what everybody's been worried about the most. Does it affect DNA, or can it affect inheritance in a way that can have long-term effects? At the moment, it looks like no. Again, because of the way the vaccine works and gets broken down, the chances are next to zero. You can never say never, but the chances are next to zero that it would have a long-term effect. One really important thing to say, so I have a daughter that was pregnant during COVID. She got the vaccine the moment she could get the vaccine. The baby's 8 months old now. Everybody's doing great. But the fear, and I have a foster daughter who got Johnson & Johnson during pregnancy, and her baby's a year old, and they're all doing great as well. That family's gotten COVID, but none of them have gotten very sick. And one of my colleagues at the School of Public Health has a 1.5-year-old that she put in a drug trial now for the vaccine because, the cutoff age is 5 years old still. And that child is doing super well, no problems. It looks like the answer to this is no. We do know that there's a huge trade-off, that the impact of the virus on people that were pregnant and mostly on people that were pregnant was horrific for some people. And the trade-off was really obvious. It was really obvious that needed to be prevented. Again, the science suggests that there would not be an adverse effect. You can imagine that all of that research, all the data is being collected and amassed, and millions of people around the world are being followed over time. So far, it looks like no, but we're all watching the information as it rolls out. Thanks.
Thank you. Thank you for your questions. I wanted to take this time to open the floor for any questions that were needed to be answered, or someone had like a really bearing question for either the doctor or Dayamanti. So we can allow that time to do now. And then also for a little bit of interaction, if you could write 1 or 2 summarizing words from the event that may have surprised you, or maybe a fact that you've learned today, or even if you are like, hey, I really like this program, I'd like to learn more about it, you can raise your hand or either put it in the chat wherever you feel most comfortable at.
Hi, I had a quick question.
Oh, okay. 1 second. Okay. Go ahead.
My question was actually for Doctor. I just wanted to with the new variant that we are hearing a lot about on the news and those types of things, I just wanted to kind of get your point of view of how it will be affecting us, especially here in Chicago, with no travel mandates or anything kind of, really being in place right now. How do you kind of see that going and how it will affect us?
Yeah, I anticipated this question because I think this is the burning question. First of all, nobody knows. I don't want to pretend like that isn't, the answer to that question is actually known. What I can say is that the Omicron, the new variant is an Omicron variant. And it looks like people that got COVID, the Omicron variant of COVID in the last couple months are protected from this variant. And there are suggestions that this variant is a little more problematic than the Omicron overall. So we saw with the Omicron that people, that hospitalizations continued to come down, like people were getting infected, but hospitalizations continued to come down, that people weren't getting too sick. Now, of course, the question there is whether we just did really well with the underlying vaccinations. And the vaccinations look like they're protective against Omicron. The problem with the vaccinations is that it looks like immunity might wane a little bit after about 5 or 6 months. And so people that were more recently vaccinated were more protected, let's say, from catching Omicron, but people that were vaccinated at all with 2 vaccines, with 2 doses, did much, much better with the Omicron variant. So I'm hopeful that, we're in good shape. Over 70% of people in Illinois are vaccinated, which is great. And the vaccine is going to be rolled out for even younger kids. A lot of youth are getting vaccinated now. So that's also great. The predictions are that the S is going to hit the fan. The predictions are, if that's going to happen, it will happen sometime between middle April and June. So we can all look for that, to see what happens. But I've seen predictions that, first of all, we're outside more. So that's better. People are cautiously coming out of our, our environments out into the open. People are still wearing masks and socially distancing. I know at UIC, I teach at UIC, and I have to wear a mask when I'm in the classroom teaching. So, I think we're coming out of it slowly, and all of that's going to help. So I'm optimistic that we're not going to see too much damage here, but we're all going to see this together.
Thank you. We have a question from Mr. Barber. You can unmute yourself, sir.
My question has to do with antibodies. If you could talk a little bit about how the vaccine affects us to build up our antibodies against the virus.
Yeah, so my understanding is that the messenger RNA that codes for an antibody to the spike protein of the coronavirus, the mRNA is embedded in this kind of fatty blob, and it gets injected and it goes around in the bloodstream and it enters cells, and it causes the cells to create the antibodies to the spike protein, and those antibodies get displayed on the surface of the cell, and the mRNA that causes all that to happen, as I said before, gets destroyed, and then we have those antibodies that are hanging around. What happens with the antibodies is that if your body doesn't get challenged again with the virus or with another vaccine, over time that wanes. You know, the antibodies, like they're not on full alert, and over time the amount of alert that they're on, it just kind of wanes, which is the reason for the need for boosters or a second vaccine and boosters. You know, and I think the final word is not in. I mean, it looks like immunity wanes after 5 or 6 months, but does it go away completely? Probably not. And just to say that that's not abnormal. I mean, that's what happens if we have an exposure to any virus. Or any allergen even, that you develop antibodies to that. And in the beginning, those antibodies are kind of on high alert, but if they don't get challenged again, they kind of dwindle and sort of lay low for a while. And some of them are better at revving back up and protecting you than other ones. So like, let's see, measles. Measles is a good example, right? Measles is very contagious. We get the MMR. We used to think that that vaccine would protect us for life, but then we found that there were outbreaks in kids like a decade or 2 decades after the first. So now we give a booster, but the immunity for measles sticks around. Measles, mumps, rubella, it sticks around for a really long time. And then polio, same. But then there are other viruses like coronaviruses where immunity just doesn't last for as long of a time. And that depends on the virus. So does that answer your question? Did I say too much?
That does answer my question. The reason that I asked that question is twofold. One, a lot of people think that if our antibodies are building up, then over time we build up antibodies and we develop a resistance to the virus itself. The second part of why I asked that question is that a lot of the anti-vaxxers are not understanding the difference between RNA and DNA, tell people that our DNA structure has been changed as a result of taking the vaccine.
Yeah, those are really important questions. You know, we're assaulted by viruses and, foreign substances all the time. We are elaborating antibodies all the time. We don't get sick. I mean, we can walk around on the planet and not be sick all the time and not get cancer even, because we have antibodies all the time that are forming and laying in wait to prevent infections and foreign substances from harming us. So the idea that you could get too many antibodies is pretty flawed. I mean, we are all about antibodies. We're antibody machines. And so I can't see how that could possibly be problematic. So for that question. RNA DNA question. The mRNA that you get injected with, it doesn't go into the nucleus where the DNA is residing. It goes, if you remember your cell from your, junior high science class, you have a cell, and inside the cell you have a nucleus, and your DNA resides inside the nucleus. There's some DNA inside mitochondria, and the mRNA that comes in is not getting into those realms at all. That's the first thing. So it isn't altering your genetic code at all. What it's doing is it's hanging around in your cytoplasm, in the glob of stuff that's outside the nucleus, and it's acting like the RNA that gets produced by your DNA. So it's kind of standing in for that, and it's creating those antibodies, which are proteins. It's creating them in the nucleus, outside the nucleus, but inside the cell, and acting like the RNA that would get produced by your DNA, but it doesn't interact with the DNA per se. And again, it gets degraded pretty quickly, so it doesn't hang around in there too long.
Good.
Thank you. I saw a question from Linda for Dayamanti, so we'll go ahead and allow them that to happen. Dayamanti.
Yes, I see the question in the chat. I'll read it out. What are some solutions that youth have been discussing as a result of COVID while addressing existing issues such as community violence and mental health? How can adults amplify your voices? Okay. I think that some things that we've really been discussing is something I was mentioning earlier about how we can lean into community and how we can continue to support folks as the world continues to change. Something that has been a constant is like violence and mental health, right? Like no pandemic or any type of world situation has stopped those things. So I think that something that we've been discussing is how can we still process community violence? How can we still process police violence? How can we still process mental health as things that are still happening while the world changes? I think what we saw in the summer of 2020 was a lot of protests. We had like the longest running period of protests in a really long time following George Floyd being murdered. So what we saw is how can those things change? So we saw the culture of protesting change a little bit over that time, right? We were all kind of like already ready to do the same things that we had did pre-pandemic, but in the pandemic, we had to notice that people needed things differently. We're seeking change, right? Like we're seeking tangible change and things that can happen. So something that GoodKids MadCity has put in place is a peace book. So now we're looking to instill peace books in our communities, which basically means that community is the solution to the violence. So the people in the community will be incentivized through payment, housing, food, to be able to keep their community safe. They know the people in the community. They can solve the violence that is happening, conflict resolution, teaching them restorative justice practices so that they can go to their peers and say like, we shouldn't be doing this, right? It also means that we instill a safe zone in each community so that kids have a safe place to go and play. They have a place that really makes them feel like they don't have to worry. Parents can send their students there. Parents can send their students, parents can send their kids, and teachers can send their students there safely, feeling like they truly have a place in the community and they can go and they can make friends without that threat, that constant threat of violence. And throughout time, this is hoped and proved as we've been instilling this in certain communities and neighborhoods to reduce the violence, right? When you see that your community member is saying something to you and asking you to keep the community safe, that is a lot more effective than people outside of the community coming in telling people that this community needs to be safe. They're really able to see it and look at it. So we're trying to shift the focus of violence, right? Like violence does not stop. Violence continues to happen. And as much as we want to say stop the violence, as much as we want to say it needs to be a halt to it, we have to figure out how to work with violence as it is something that continues to happen. How do we stop criminalizing those practices and really help people get to the root cause of violence rather than criminalizing them for it happening? It will happen. It is something that we have seen throughout the years. It has been a part of our existence. It is embedded into earth. It is embedded into the world, right? So if it is something that is going to continue to happen, how can we reduce the impact of it happening? How can we make sure that folks feel okay for expressing their emotion that way and helping them understand better ways to express it later? And I think that the reason violence is so high and the reason we continue to, it has such a big effect on mental health is because it is something that is seen as inherently bad, right? But I think we have to understand that if we remove the negative connotation from the word violence, then we begin to understand how to unpack it and really take apart the issues of it, and then we can attack those individually, which really I think curates a much better world in the end.
Wow. Okay, Dayamanti. Thank you, Dr. Forst and Dayamanti Wallace, for joining us today. I really appreciate your nuggets of knowledge that you've given us. I want to give thanks to everyone, a part of the team who've helped to make this event happen. Again, if you have any questions about any programs that we offer at the North Lawndale Employment Network, Bradley and Elena and Michael have been so gracious to put that in the chat. So we have resources available. And again, thank you for joining.
Thank you. Great
Thank
to see
everyone.
you guys. Great work, Dayamanti. Great work.
Hey everyone. Just before we log off, I do want to take a screenshot to share externally. So if I could have folks smile, if you would rather stay off camera, that is perfectly fine. I just want to take a screenshot to kind of, share what we've been doing. So on the count of 3, can everyone your big cheesy smile and hold it until I tell you that we're ready. So 1, 2, 3, smile. All right, thank you all so much.
Yep, I'll post really quickly everyone's socials. Okay, well, I guess I'll see you guys on the Teams chat. I'm gonna end the call.
Great job.
Thank you so much. Excellent work.
Thank you, everyone.